Hi everybody, welcome back to the Cool Blue Classroom. My name is Ashley. Today we are celebrating Harry Potter's birthday because I am a super nerd, okay, all around. Since today is Harry Potter's birthday, I thought today would be a great day to talk about lightning injuries. Now, let's get on with our content. Lightning strikes. So there's a big myth associated with lightning strike victims. People often think that once a person's been struck by lightning that they carry a charge after they've been struck. However, that is a major myth. There is no electrical charge that continues to make the patient hot, so to speak. So you can't then touch the victim and also in turn get an electrical event. So in patients who are struck by lightning, there is a risk for cardiac arrest. Typically, the presenting rhythms in cardiac arrest are going to be asystole and ventricular fibrillation. There is a high chance of survival for younger patients who go into cardiac arrest. That's why it's important to properly identify your rhythm and treat appropriately utilizing the ACLS guidelines. So there are 5 important things that I think we should go over for victims who have been struck by lightning. Nursing considerations specifically, or anyone who's caring for a lightning strike victim. I'm going to go over cardiac monitoring first. So, as I mentioned with cardiac arrest, cardiac dysrhythmias that lead to cardiac arrest are concerning. Patients who present with any sort of cardiac dysrhythmia can actually take up to 3 days to present with any sort of dysrhythmia, so it may require prolonged cardiac monitoring for these patients if severe enough. Typically, you're going to see ST elevation, prolonged QT. We can see atrial fibrillation. Number 2, we're going to do neurochecks in these patients. So anyone struck by lightning, we want to make sure that there's no neuro damage. In severe cases, patients can go into coma. They can get cerebral edema, cerebellar ataxia. Patients can experience like numbness and tingling sensations in various portions of their body because those nerve cells get excited when any sort of electrical current encounters them, and therefore it could take a little while for them to wake up. It's almost a sensation like things fell asleep, or even sharp, severe sort of neuropathic kind of pain. Additionally, patients can also experience seizures from that electrical disruption. So this is why it's important to make sure that we're doing really complete neuro exams on our patients and making sure nothing is changing. Number 3, we want to make sure we're monitoring and asking about hearing and vision changes. So in a lightning strike, you can rupture the tympanic membrane in your ear, resulting in hearing loss. Additionally, flashes of lightning are super bright and cause profound damage to the eyes. Number 4 is burns. So lightning, heat, there is a risk for burns. What makes this different from other electrical burns is that they tend to be more superficial than a regular electrical burn, say from like an outlet, which is going to have a much more deeper tissue injury. Interestingly, much like the design pattern of a nerve ending, we're going to get this. I use the word cool, but just note I don't mean cool that like the person's burned themselves. It's just a unique pattern. The pattern is called Lichtenberg figure. It's got this like fern-like appearance. Like I said, almost like a nerve ending, and it's cool how it kind of like branches out. It's very unique. It's superficial to the skin, and it's very indicative of a lightning strike. Number 5. We're going to monitor urine output. So there's an increased risk of rhabdomyolysis because of that muscle breakdown associated with the lightning strike injury. So we might notice some iced tea colored urine because that myoglobin broken down, filtered out by the kidneys is going to turn that iced tea color. Some wicked Harry Potter potion there right in the pee. So there's a unique phenomenon to lightning strike victims, and it is very Harry Potter-esque. So you remember that scene where Neville gets the Petrificus Totalis spell placed on him and he kind of like locks and falls backwards? So interestingly, lightning strikes can do something similar. It is called coronoparalysis. However, I will tell you it's typically not the whole body. Typically, most common in the lower extremities. However, it can cause hemiparalysis and cause pallor, coolness of the limbs. It is transient, it will go away. However, very frightening for our patients, so we should encourage them through that period, and important why we should continue our neuro assessments and our cardiac monitoring. This just kind of reinforces all of those ideas that we talked about. There's 2 like mimicries of the coronoparalysis, loss of peripheral pulses. So you could accidentally think your patient is in cardiac arrest, which is why it's important to check our central pulses in patients who have been struck by lightning. Second, these patients also are at risk for being confused for spinal cord injury, which brings me to another good point. lightning strike is a strong force. And if there's a risk for trauma that the patient fell off of something, I would always follow C-spine precautions and assume that the patient has a spinal cord injury. However, it is common to like mimic the spinal cord injury. And so we should be performing imaging just to rule out spinal cord injury, treat them like they have a spinal cord injury until proven otherwise. Maintain your C-spine precautions. Support for these patients is typically supportive when it comes to the coronal paralysis, just so you know. Well, that does it for today's video, guys. Thank you for joining me on my nerdy episode of the Code Blue Classroom. I hope you liked it. If you liked it, give me a lightning bolt in the comments down below. As always, knowledge is your best code card. Stock it well. Bye, guys.